over the world. So it might be good morning, good afternoon, good evening to some of you. My name is Alamin Yusuf. I work with the UNESCO Regional Office for Southern Africa webinar. But first and foremost, let's tackle the ground rules for this webinar first. Colleagues, please note that this webinar is being recorded. And we are doing this so that we can have a very good report at the end of the day. And we hope we'll be able to share this report with all of you who have registered. We have also activated the Q&A feature for this webinar. So if you have any questions during the session, you're encouraged to use the Q&A box shortly. Zoom, you see down there on those buttons, if you move to the right from the camera and muting and everything, you see Q&A next to chat box. So use that to put your questions so that they can be addressed. And if you want to take the floor during the webinar, please raise your hand so that the moderator will give you the floor. But also remember to lower your hand when you're done. At the same time, we're encouraging you to minimize interruptions during the sessions as much as possible. As you can see, we only have 90 minutes for this webinar. So if it's not a really burning issue, please reserve your contributions for the session that we have organized for general discussions. We also understand that some of us are challenged by internet bandwidth. From time to time, we all have limited internet bandwidth. So for our esteemed panelists, please switch off your video and mute your mics during the sessions. And preferably, you can only turn them on when you take the floor. And for everybody else, if you happen to encounter any technical problems, it is very likely that it's connectivity which might be the culprit. And of course, most of the technical challenges are usually addressed by rejoining the webinar. Please don't just leave if that happens, because I can assure you that we'll be eagerly waiting and expecting for your return. This webinar will take about 90 minutes. We'll start with opening remarks from the UNESCO offices in Harare and Cairo, followed by panelist presentations and discussions. Thereafter, we'll have plenary discussions, followed by a presentation and a demonstration on how 3D animated videos can be used to address behavior change for public health emergencies like COVID-19. We will later on wind up the webinar with a Q&A session. And remember, this Q&A session will very much be focused on the questions that you type in the Q&A box. So don't miss out typing those questions in there. And finally, we'll have closing remarks, which will be delivered by UNESCO Cairo office. Distinguished ladies and gentlemen, this webinar is a result of collaboration between UNESCO Regional Office for Southern Africa, the UNESCO Regional Bureau for Sciences in the Arab States, Naledi 3D Factory, the esteemed panelists you all see, or you will soon hear from them, and of course, each and every one of you who's participating here today. But unfortunately, and also in the interest of time, we may not have time to introduce everybody. So allow me, first and foremost, to introduce the panelists for this webinar. And my dear panelists, please switch on your camera for a few seconds and wave to the participants when I introduce you. So first, I would like to introduce Professor Hubert Heisen, who's the director and representative of UNESCO Regional Office for Southern Africa, also known as UNESCO Harare Office. A warm welcome, sir, to the webinar. I would also like to introduce Dr. Gaith Faris. Dr. Gaith is the director and representative of UNESCO Regional Bureau for Sciences in the Arab States, also known as UNESCO Cairo Office. A warm welcome to you, Dr. Gaith, and please wave your hand to the participants. From the panelist bench, we have Patience Zirima, who's the executive director at the Media Monitors. Patience is experienced in media monitoring, media research, and media policy and advocacy, and with a focus on internet governance, media freedom, and media professionalism. Patience also has long-term experience working in the area of promoting freedom of expression, citizens' access to information, and communication for development. A warm welcome, Patience. The next member of the panel is Asad Lilani. Asad is the Director of Political Strategy at the Access Challenge. And this organization, the Access Challenge, has a flagship campaign to support the AU, Africa CDC, and WHO to achieve universal health coverage in Africa by 2030. The Access Challenge are in partnership with Africa CDC and WHO Afro to start a COVID-19 communication campaign called One by One Target COVID-19. Asad is a native of Tanzania and has previously worked in business development, corporate strategy, and most recently was an economic and international relations research analyst working directly with the former Tanzanian president, His Excellency, Dr. Jakaya Kikwete at New York University. Thank you so much, Asad, for waking up so early to join us today. And my dear colleagues and distinguished participants, Asad is joining us all the way from the United States of America. Thank you so much, Asad. We also have Norman Mampane, who's the former Police and Prison Civil Rights Union national spokesperson, and he's currently working with the Confederation of South Africa Trade Unions, COSATU. A warm welcome, Norman. We look forward to hearing from you, especially from the labor point of view.
Thank you.
We also have Dave Lockwood, who will also be speaking today. Dave is a UNESCO partner who's moving this panel. Dave is the CEO at the Naledi 3D Factory. Naledi 3D Factory specializes in virtual reality and visualization of ideas and concepts. They mostly work in the education sector and have keen interest in developing content for disadvantaged communities in addressing language and literacy barriers. A warm welcome, Dave. And without any delays, let me take this opportunity to welcome Prof. Hubert Heisen to deliver his welcoming remarks, which will be conveyed to you from UNESCO in Harare. Over to you, Prof.
Yeah, thank you, Alamin. Dear colleagues and friends out there, greetings from UNESCO Regional Office for Southern Africa. A very good afternoon, or morning or evening, depending on where you are, and welcome to all connected to this virtual space that we're in nowadays, and to this webinar, which is taking place, of course, at a time when many countries in Africa are slowly opening up from the devastating COVID-19 pandemic, and the also equally devastating lockdowns, and these are so devastating to the local economies and the livelihoods of people. So while we are receiving positive news, I'm sure you heard yesterday again about a successful vaccine, the pandemic is far from over, and therefore there is a continued need for COVID-19 communications and information. In these times of COVID, and in fact during any crisis, there are three important functions of communication and information that I believe deserve attention. And let me therefore briefly touch on these three functions. The first, to ensure proactive generation and sharing of relevant information and quality information. We saw it, especially at the outbreak period of this pandemic, that the general public and also specific stakeholder groups, they are hungry for information. Many questions are there. What are the latest infection numbers? Which behavior reduces transmission? What are the symptoms of COVID infection? What to do in case of a suspected infection? What are the advancements of science? What about medicines or vaccines? How reliable are these? What about job security? And what about the economy? And hundreds of more and more questions, and a hunger for information around these. And the role of communication and information in the context of COVID-19 is actually twofold. First, to try and influence behaviors of people, to reduce infections, to save lives and reduce health impact. And the second is to minimize economic impact by reducing the need, the frequency, and also the extent and the period of lockdowns that we have seen in most countries all over the world. And again, this is also all related again to behavior. Because if we stick to behaviors that have proven to reduce transmission, then there is no need to go for lockdowns, and therefore this interrelationship. The Economic Commission for Africa estimates that if we lock down 1 month across Africa, across the continent, it will cost the continent about 2.5% of its annual GDP. So that we're talking about $65 billion US. And that's just an indication of the extent of economic and financial damages that is taking place at the moment. Now, mobilizing all stakeholders in inclusive communication to mitigate further risk, and I mean both health and economic risk, to mitigate further risks associated with the COVID pandemic is of utmost importance for Africa. Let me come to the second key function of communication and information, which is to manage dis and misinformation. And this is as important as the first function. It is really frightening to see that mis and disinformation spreads even faster than the virus itself. Besides, we should be aware that rumors, complot theories, and inaccurate or even false information can be as lethal as the virus itself. In the words of the UN Secretary General, Antonio Guterres, and I quote him in saying, in the face of this lethal disease, we must do our utmost to halt deadly misinformation. End of quote. Now, we have all heard the wild speculations that pop up, especially in the first part of the pandemic. The rumors that the virus is man-made. Well, really? Injecting bleach might kill the virus. Well, probably, but a good chance it might kill you too. And that was not added to the information. I heard one on the new 5G telecom system causing the virus. I would ask, really? You know? Now, this fake news and conspiracy theories can lead to serious harm to individuals. It can lead to panic and chaos. It can fuel the spread of the pandemic further. Or worse, it could lead to geopolitical tensions or even wars. Who knows? So through fact-checking and delivery of information which has been verified, journalists and the media are in a key position, in fact, in the front line of the fight against the distortion of truth, because that's what fake news is about. It is about distortion of the truth. And this is therefore an ethical responsibility, which is at the core of the profession. And that is why we need to support a free, independent, and pluralistic media which can support, which can report without fear or favor. Of course, there is also a responsibility with the consumers of information, and we should ask questions all the time. Whenever you read something, question. Is this true? What is the source? How relevant is it? Therefore, this calls for a strengthening of media information literacy, and even in the social media domain. The use of digital technologies in the absence of media and information literacy is in fact a dangerous combination. So what we need is quality information, we need fact-checking, we need investigative journalism, and also to emphasize, we need stronger media and information literacy. And that brings me to the third and last key function of communication and information, which is to ensure universal access to information. And we have a particular day in September on this, a UN day. The challenge of misuse of digital technologies is further compounded by the fact that inequality of access to broadband connectivity in Africa in particular hinders effective and inclusive access to vital health and life-saving information. The ITU, the International Telecom Union, a UN agency, estimates that globally about half of the world's population, some 3.6 billion people, remain offline today. So don't take it for granted that everyone is on the internet. And the majority of these living in the least developed countries and in the rural parts in Africa. And even in situations where citizens do have internet access and connectivity, look at the cost of data here in Zimbabwe. This is impeding access for many of the poorer segment of the population. So the costs are keeping people away from being connected. And then you have the connectivity and the speed of connection, or the hardware, which limits their access. And therefore we must pay attention also to the format in which we package information, and think about packaging it in a low data requirement format. We have in several occasions, in several of our programs, we had to actually significantly reduce the quality of material to allow beneficiaries in rural areas to fully access the content using limited bandwidth and hardware. Our experience shows that the lack of access to connectivity can lead to marginalized communities to become even more vulnerable in times of emergency. Besides the packaging, so the low data requirement, we also need to look at tailoring of messaging for specific target groups. Think about school-going young people in rural areas. They would need specific information. Women, the disabled, those who live in dense communities. Think about slum areas, think about refugee camps, and how tailor information to them, how they in these settings can protect themselves. Now, unfortunately, the lack of human and financial resources in Africa has shown to be impeding these efforts to invest in specific and tailored information for specific target groups. And then we need to be aware of the low literacy rates in general. We're talking about 70% in Africa, more or less. And especially in the already left behind communities, the rural communities, where literacy rates are typically low. And there we would need to step up other communication tools, such as community radio, or using cartoons or animated videos, which is part of your discussions today. So in concluding, let me emphasize again that in times of crisis, we need to step up significantly our production and access to quality information, not only to combat the pandemic, but also to leverage the implementation and the attainment of the 2030 UN agenda and the SDGs locally, nationally, and globally. I end by saying to all of you here present and connected, please join us to make this happen. Thank you very much. And over to you, Alamin.
For the welcoming remarks. I think you explained very well on the importance of communication and its key functions, especially in relation to behavior change. And Prof explained very well that if communication was effective, maybe we would not need all these lockdowns. Thank you very much indeed, Prof, for your message. So now let's move to the next speaker. I'd like to welcome Dr. Gaith. Dr. Gaith, please take the virtual floor. It's all yours. A warm welcome, Dr. Gaith.
Thank you very much. I hope I'm heard and seen well, right?
Yes, loud and clear, and we can see you as well, Gaith. Good afternoon.
Good afternoon. How are you, Hubert? How are you, colleagues? Excellencies, ladies and gentlemen, colleagues in Africa and from all over the world who are joining us at this moment. On behalf of the UNESCO Regional Bureau for Sciences in the Arab States, the UNESCO Cairo office, and on my own behalf, it gives me a great pleasure to welcome you to the opening of this webinar, Communicating Effective Messaging as we reopen African economies during the COVID-19. UNESCO Harare and Cairo offices have jointly are jointly organizing this event in collaboration with the Naledi 3D. We are also pleased to have partners from intergovernmental, governmental, and civil society organizations. This collective effort demonstrates that effectively responding to the COVID-19 pandemic requires all stakeholders, and we are happy to have many of the key stakeholders is affecting all countries. It is touching every aspect of life, sending shock waves of uncertainty across the societies, economies, and may with direct impact on individuals. 9 months into this pandemic, we see healthcare workers in many countries still working tirelessly to save lives and bring relief. We see citizens of all ages becoming tired and resentful of social distancing, travel restrictions, and other measures that we all found ourselves having to abide to. We are all seeing despair, concern about the future, and dissatisfaction. Disinformation is amplifying all these worries, and we see rumors spreading, distrust, social unrest, and stigmatization. As a result, many countries who had initial success in managing the pandemic are now facing far greater challenges. Not only because of that, but definitely this information can play a big part of it. Around the globe, research teams, on the other hand, around the globe, research teams are working night and day to create a vaccine or maybe some medication. However, it is still not clear when these treatments will become widely available. We heard the good news today, a couple of days ago, about some new vaccines here and there, and we are all happy to be available to us, particularly to developing countries. When will they be available to the African countries? When will be able to reach the remote villages in Africa? So we need to keep our so we have to be also cautiously optimistic, should I say. So, and we need to keep protecting ourselves, and we need to keep on following the safety measures, at least for some time. Fortunately, Africa has not seen the scale of outbreaks in other countries that other countries have experienced. However, we cannot be complacent about it. We have still to be quite prepared for all scenarios. Life must go on, and we need to learn and earn. However, we must do that safely. We must exercise the new social behaviors and precautions necessary for keeping COVID-19 away. Every person must have the knowledge, confidence, and means to take actions based on evidence and scientific information, not rumors, not he said, she said. We should function based on reliable information. Access to reliable and accurate information is critical at the best of times. But during the crisis, a crisis like COVID-19 pandemic, it is, or it can be actually a matter of life and death. As we seek to raise public awareness, we must think about their needs, concerns, and characteristics. We must package our messages appropriately to fit them, to ensure that it reaches them. We must remember groups like rural population and persons with disabilities. All segments of the society should be taken into consideration. Africa has made tremendous progress, but with literacy rates around 70%, there are many persons who cannot read and write. Africa's cultural and linguistic diversity, with over 2,000 distinct languages, is a source of richness, but it is also a challenge when delivering the public service messages. According to the Brookings Institute, the median population across Africa is around 20 of age, while the median age of leaders is about 62. So we do have to navigate this generational gap in our message. We need to engage the youth. We are talking about a young population all over Africa. And so we need to engage them more effectively in our decisions and hence in our action. In Africa's unique demographic settings, we need visual communication that is culturally relevant and age appropriate. Many are not being reached by current campaigns, unfortunately. We must act now and effectively deliver our life-saving messages before it's too late for some. By joining forces with Naledi 3D Factory and other partners gathered here, we will reach the unreached. We should work towards that, and I am confident with the cooperation of all, we can make a difference. The pandemic has shown no regard of our divisions, whether geographic, social, economic, ethnic, gender-related, ideological, or whatever other forms they may take. We are all facing the same. The real lesson of COVID-19 is not only that we should find a cure or a vaccine, but also that we must enhance our collaboration and overcome our divides. By doing so, we can accelerate progress in finding solutions to the many societal, economic, and environmental challenges that we are facing. Once again, I thank each of you as we work together to ensure that no one is left behind. Thank you very much.
Thank you very much, Dr. Gaith. For your very one is that even though Africa has not suffered as much as other regions of the world, we should not be complacent. And access to information has a key role to play. Thank you very much, Dr. Gaith. I wish there was an upload feature here in Zoom. Unfortunately, there is none. I, however, believe each and every one of us has uploaded the opening remarks in our own virtual corners. So we are a little bit behind time, so maybe we should move ahead. And after hearing the opening remarks from our two eminent speakers, it's now time to hear from the experts in the field. And the first one to speak will be Patience Zirima from Media Monitors. Patience will present about lessons learned from initial COVID-19 communication campaigns. And she has been working with UNESCO in conducting media monitoring in Southern Africa. A warm welcome, Patience, and over to you. Patience, are you online?
Hi, Alamin. Yeah, yes, Patience, she's online, and I see she has tried to unmute her mic, but we cannot hear anything from her. I assume there's a problem with her mic.
Okay, Patience, let us know maybe in 2 or 3 seconds if you can present, or else we can ask the next. Unmute your mic, Patience. Yes, there you are. Go ahead. Patience, you're muted.
Mr. Chairman, may I I would like, with your with the permission of all, would like to excuse myself as I have another actually activity that I need to attend. So thank you very much and wishing you all the best in your deliberations. I trust my colleague Paul will continue with you, and we here at UNESCO Cairo will stand ready and available to provide any possible support.
Thank you very much, Dr. Gaith. And if you get an opportunity to rejoin us later, if ever, you're warmly welcomed. But we really appreciate for your time. Thank you very much, and all the best with your
Thank you.
Meetings. Thanks. Bye-bye. Maybe we should move to Patience is not available for now. I think we should move to Asad. Asad, can you please take over from Patience for now?
Sure. Thank you, Lamin Yusuf. Can everyone hear me okay?
We can hear you loud and clear.
Perfect. Thank you, Yusuf, and thank you, Dave. And greetings from New York. Let me just start off by thanking the UNESCO Regional Office for Southern Africa, and the Regional Bureau for Sciences in the Arab States, the Nailed-In I3D Factory, as well as Dave for having this event and for inviting the Access Challenge, to contribute to this important discussion. So let me just maybe start off by giving a brief of the intro of the Access Challenge. So the Access Challenge is a nonprofit that is working on like a flagship campaign called 1x1 Target 2030 to advance universal health coverage in Africa, supporting the AU, the Africa CDC, and the WHO's goal to achieve universal health coverage by 2030. So we advance universal health coverage through three ways. Trying to get the head of state commitment from all countries in Africa to make UHC their goal, because we believe the head of state engagement is the first step to achieve such a big goal. Second, we have global conferences to continue the conversation on UHC. And then third, we have mass media campaigns and communications to promote UHC and health behaviors across Africa. And the whole model is to ensure that everyone from a mother in the village to the head of state are all playing a part to advance UHC in their own countries. So with the COVID-19 pandemic upon us, we quickly debriefed with the Africa CDC. And then in May of this year, we partnered with the CDC to launch a COVID campaign called the 1x1 Target COVID-19 campaign, which is a subset of our main UHC campaign. So the campaign was aimed to support efforts by the African Union and like the CDC for its COVID-19 fund, by trying to advocate for increased financing for Africa CDC to strengthen PPE and testing for its COVID-19 response. And so far, we have gathered a few private sector partners and we raised close to $4 million for the Africa CDC to strengthen the PPEs and testing. And then we complemented, those fundraising efforts by media and communications to disseminate key messages about COVID-19 to different population groups in Africa. And our aim was to reach every household across the continent. So when we started in May, we some very well-intentional people, big influencers with large platforms, and from individuals who sometimes pretend to be top experts, who may be spreading bad advice. And there were like a lot of rumors, for example, that like drinking alcohol will keep you safe from COVID-19. One other big one was, COVID-19 does not affect people who reside, in like a warm country, control of the people by putting a microchip in every one of them. And I'm sure you guys have heard a lot more. So during that period, the misinformation was so prevalent that I remember the Director General of the WHO in one of the WHO's press briefing, and I'm quoting him, he said, "We're not just fighting, a virus and an epidemic, but we're fighting an infodemic." And that shows, the complexity and the challenge that we were facing then, and we're still facing up until today. So thus in May, we started, a communications campaign, starting with trying to debunk the biggest myths in Africa. We created a set of fun videos talking to the African population, calling out this false information directly and trying to debunk the myths directly. Further, we did not only like debunk the myth, but we told them what was actually happening. So for example, saying that not only is it false that drinking alcohol will keep you safe, but the only thing that can keep you safe, is to wear a mask, to wash your hands, or to practice social distancing. And that's the only thing that was known at that time. So we created these videos and the messages were crafted and approved by the CDC and like the WHO to ensure that these messages were coming from the health experts as well. So a couple months later, we did like another quick survey and like a landscape analysis with the CDC. And then we found out that countries were trying to open up their economies and people were not really going to be in a lockdown much longer. So we realized that countries, were opening up their economies, people were going back to work, children were going back to school. So thus we created a new round of messages through these videos that focused on African countries opening up their economies. So that while they do this, there's a comms campaign around it for people to not forget about the virus. So we created, again, new fun messages on social distancing guidelines, trying to wash your hands, how to wear a mask, promoting people to wear a mask, and promoting people to do the right thing. This again, was aimed at like the reality that countries will not be listening, that we can through a communications and like a behavior change campaign. Now coming to the heart of this discussion and my, and like my focus for this discussion, which is, like the message transmitted versus message received. Is there a need for local messaging? So the biggest thing that we found was that, we had created crucial messages, that were fun, that were designed well, and were short for people to take this information quickly. However, the issue was getting to every household in Africa. So first we decided, that like every video that we created will be created in 4 of the biggest languages spoken in Africa. So we created each video that we had in French, English, Portuguese, and Arabic to ensure that every region in Africa is being considered. Second, we started thinking about the distribution. So just focusing, on something like social media, for example, was not going to have a big meaningful impact in Africa. Right. So if we look at Africa, it has 54 countries, over 1,000 languages, different cultures, different technologies, based on which country you're at. So if you're in a country like Kenya, for example, there's a big social media usage there. People use, things like Twitter a lot. However, in a place like Uganda, like the biggest distribution platform is something like radio, because that's what people use to consume the information. So thus, to ensure that every household in Africa gets the information, we started to partner with different, local, companies and organizations on the ground to broaden our distribution and, like the delivery platform. So for example, we partnered, with Living Goods, for example, and now, our messages are running in over 55 radio stations across East Africa. We are currently working, with some like news outlets such as CNBC Africa, who gave us free airtime for 6 months to air our messages, for like the African populations living globally and in Africa. We're currently working, with like major airlines such as Emirates to see if they can play our messages before a plane, tries to land in a country in Africa, because that's how we believe like the virus spreads, through like the traveling. And then, like we're also working, with the community and faith leaders, through like WhatsApp groups to ensure that like the community leaders are, like well informed to be able to lead their respective local communities to do the right thing. And, we're also working, with a few like ministries of health across Africa to customize these messages for them as well. So when we talk about messages, being transmitted versus messages, that are actually, so like received by the people, these are the things that we need to consider if we want to ensure that everyone is going to get the message. Like a mother in the village, a blue collar worker with a corporate job, or like a taxi driver, or like a young kid going to school. And like, we're now trying to increase our distribution strategy, by engaging, popular celebrities, musicians, media personalities, athletes, comedians, faith and community leaders, for them to be informed mouthpieces, for like disseminating accurate public health information. And this is, sort of like our effort to ensure that we're trying to get to every population, and we need to engage all of these people so we can ensure whether it's the youth or a mother, like I mentioned before, are getting, these life-saving messages. And, we've just finalized, our like recent partnership with like the Rockefeller Foundation now to continue even more, to ensure that people who are not getting these messages are now getting these messages. So now we're looking at country-specific behavior change campaigns in places like DRC and Zambia that may not have received, much like communication support because the limelight has gone to other big countries. And like, this again is to ensure that no one is left behind. Further, we are working, on like a media workshop for influencers across Africa to equip them with the right messages and, a communications toolkit so that, like these influencers can use their power to ensure that people are doing the right thing. So all of this is to ensure that these life-saving, messages and the information is actually getting to the furthest flung and people that need it. The main point of creating these messages is for the masses and like the population. And if people are not seeing this content, there's no point of creating these messages. So we're trying to ensure that our life-saving messages are going far and wide across the continent. To sum up my discussion, the African citizens and like the African continent cannot, cannot afford to be left out of these life-saving guidance that can prevent the most negative effects of COVID-19, from swamping their communities and national need to work together, and the need for everyone to step up and do their part. And it is only through this collective approach, that we will be able to ensure that Africa is taking crucial steps today to curb the pandemic through an effective and collective communication strategy. Thank you for your time. And back to you, Yusuf.
Wow. Thank you so much, Asad. That was Asad Lilani, giving us a very broad and interesting perspective of message transmitted versus messages received. Congratulations for the very, very broad activities and contributions that your organization is involved in addressing the pandemic through communication. Thank you very much once again. And I think Patience has sorted out her technical challenges. So Patience, if you're online, can you please take over the floor? Patience, please take over the floor. Maybe we can move to the next speaker while Patience is still trying to sort out. Maybe we can hear from Norman now.
Yes.
And over to you, Norman. We are very eager to hear your perspectives about the challenges and experiences from employees, job losses, salary reductions, strikes, and many other challenges. We in the communication sector would like to learn more from you. Over to you, Norman.
Thanks for the opportunity. We prepared a PowerPoint. Let me just start by saying all protocol observed. What we're indicating, we may move to the next slide, is that we have agreed that COVID-19 is a trade union issue. In other words, it has affected everyone, whether rich or poor. But there are questions that we need to ask ourselves as to whether we were able to curb the spread of the coronavirus across all of our workplaces, public spaces, and our communities. It's a question that still needs answers. I'm sharing the kind of material that was shared publicly in the media. These are two cartoons from Zapiro, where he was indicating the flattening of the curve in South Africa, where the country was faced with increasing COVID-19 cases, but also on the other hand, the economy was now getting a knock. By the way, we've been in a recession even before COVID-19, and many of the jobs were now beginning to be lost during the COVID-19. The other cartoon is about what was happening in America, where in COVID-19 politics has affected the re-election of the sitting president. What we're indicating is that we want to share our own perspectives and experiences on what kind of devastation did COVID-19 cause in South Africa. If the world was not sufficiently connected before, coronavirus has done it within seconds by connecting the global village without even having structures. It has affected global economies, eroded jobs, and caused a panic across the world. Many of the flights were grounded, with many losing jobs because of coronavirus. Like, for an example, in South Africa, we still have got around 7,000 plus cases that are new cases that have been identified. So our messaging have been very consistent since the 27th of March, where our messaging was about easing the panic amongst members and workers in general. And we've used various medium, various platforms. But let me indicate that labor has never been on lockdown, because majority of workers were at work, particularly essential workers and frontline workers in the retail sector, domestic sector, and other sectors. Majority of people who are affected by COVID-19 and were working remotely are managers and those that are in supervisory roles. Let's move to the next slide. Next slide again. In the picture, we are just showing how COVID-19 has recreated our cities, where every street was deserted. This is a picture that we got from one of the media houses, where it shows the street in Cape Town that was deserted. It was the same in many other towns and cities. In the villages, that is where there was minimal impact, because in the villages, majority of our citizens' life was like normal, because it was like a township, a town or a city phenomenon, up until new cases started to erupt in the villages. And like we're indicating, and in our messaging, was that a new normal is here, and we are advocating that all workers should adhere to the WHO health protocols, wash hands, keep distance. And there was an overhaul in many of the workplaces where workers were going, changing of office spaces, inserting of windows in various offices where there were no windows. So there was a shakeup in the workplace in general. Next slide. Next slide again. Now, there were many challenges that were realized. One of the challenge was that South Africa was in the mode of formalizing the informal sector. Majority of people who were affected during coronavirus lockdown were mostly vulnerable workers, the informal sector, where most of the street traders were forced to stop trading, and many of them were forced into destitution, were forced into poverty, because there was no income, there was no money during that period of lockdown. And in the workplace, majority of our workplaces were exposed that we have been working with dysfunctional occupational health and safety committees. Now, those committees were supposed to be the entry point of every union to ensure that workers are safe, that the concerns of workers are addressed. And the majority of these workplaces were highly exposed by these dysfunctional committees. Majority of workers didn't receive their wages. We're speaking about 18.9% who also received reduced salaries during the lockdown. Majority of employers were stopping workers from coming to work through SMSs, and to the extreme dismissing them during lockdown through SMSs. So there was a pileup of many of the CCMA cases where resolutions are dealt with. And a new phenomenon of working remotely, like I said earlier, was introduced. But the challenge was that majority of our workplaces were not prepared for that kind of a scenario. Majority of those who were working remotely were working using their own private or personal data, with employers giving them less reimbursement of such funds that were committed by such workers. Like I said earlier, lack of connectivity in some of the townships, the villages, was still a problem, because people were able to move back to their rural areas, and some of them were locked out from connecting with their colleagues in order to do some of the work at at their various spaces. The next slide. So in the next slide, I'm just sharing pictures of the various practical experiences. What we did and our unions did was that they were able to customize many of the messages so that workers can be able to respond to curb the spread of coronavirus. And they were written in various languages, and all the unions were able to participate in some of the forums that were called virtually or physically before, so that they can be able to craft those messages. And one of the messages that I can read was written: "Dear workers, kindly reduce the risk of coronavirus infection by avoiding direct contact with anyone that has a fever or cough." But work was not stopped. The majority of workplaces were able to campaign, picket against inadequate provision of personal protective equipment. We were able to share widely also the messages that were prepared by the Department of Health, the WHO, and the WHO, I must commend them. They did very well by ensuring that they spread a lot of social media posters that we were able to retrieve and share them. The most devastating scenes were the spread of fake news, and many of our workers were highly affected by that. And what we did was that we were able to alert all workers and communities that spreading fake news might lead to legal prosecution. And while in South Africa, the Department of Police and the government also played their role to ensure that such kind of information should not be shared publicly, because all those people individually, they will be held liable for such kind of fake news. The sad moment was the burial of our members. Many who died during those lockdown period were buried by less than 50 people. And the pictures that were coming with the families sharing them, it was quite devastating. And this has also affected the cultural practices in terms of burying our loved ones. No night vigil, and the body will only arrive in the household in the morning, unlike when it was before, when the body will, stay over in the household families or the bereaved families, so that they will be viewing the body for the last time in the morning, and they will leave then for the graveyard. So it has changed how our communities and workers relate to each other. In the public transport, many will recall that there was a 70% occupancy in the public transport. Later it was changed to 100. People were just afraid of each other, afraid to come close to each other. It has affected them in the very most devastating way. As colleagues, some of them, their colleagues will be infected, some will not be infected. And the secrecy also came into the picture, where names were not revealed. It was just an email will come and say 4 people are infected, and workers will be guessing as to who are the 4 workers or colleagues who were infected by coronavirus. What we're indicating is that our unions in South Africa and the federations were able to venture into social dialogue at the level of network, where government, business, and organized labor meet. And some of the agreements that came out there, the economic stimulus that came out, the interventions, and including the unemployment grant that was issued to those who lost jobs of 350, came very helpful, even though we think it is not enough, but it has sparked a debate that has been put in abeyance for many years of the introduction of a national basic income grant, where any person who is not working, there must be a basic income grant that is given to such people. The unemployment in South Africa arose by 30.6%. Many people have lost their jobs. Majority of employers did not pay their employees, and some of the employees also were playing truant. Some were claiming monies from the unemployment insurance fund and not giving such money to employees, and it provoked a high level of emotions amongst workers. But like I said earlier, our unions were very helpful to can resolve some of the issues, refer some of the disputes to the Department of Employment and Labor, and also refer some of the cases to the CCMA where disputes are held. But like I said before, there was also a high demand that workers should access their pension funds in order to cushion them during that economic crisis. The debates are still going on, and we've seen in some other countries like Chile, where about 10% of their pensions were given to workers in order to cushion them during that period. In South Africa, there was also an introduction of an app by government where people can protect themselves from being infected with coronavirus. But the only area that I think was a challenge was citizens refusing that the government should intrude their privacy, because if you were subjected to assessment, the baseline assessment, they will ask you where were you, which country did you visit, which funeral did you attend, but also the usage of cell phones in order to track people who moved from one space to another brought a lot of challenge to many workers. The worst case scenario was when some people around Alexandra near Sandton were experiencing beatings from soldiers and the police, and one person also died from such kind of an incident wherein they were forced to stay in-house. And the challenge of informal settlement is that you'll find that in a shack, more than 7 people are staying in a shack. So if you say they must stay in-house during the day, where will they stay? Because there's no space in the shack. So the question of infrastructure became a problem. The question of housing became a problem. And the question of all the people who are homeless in the streets, in the towns, in the cities became a problem. Some of them, they were shifted to temporary shelters, and some of them, they were complaining that they were only given one slice of bread, and the following day, some of them were back on the street. So it provoked a lot of a demand to address some of the socio-economic issues that were left hanging by government and everyone, but also it brought other opportunities that we should work on them and ensure that we address issues of mental health, stigmatization, workers' education, on training organized labor, but more importantly, dealing with vulnerable workers, those that are primarily in the informal sector. So there are many opportunities that we can explore out of the crisis, but what is needed, and this is a messaging from international federations, that the kind of vaccines that are going to be secured must be helpful to all the people. No one must benefit out of it in terms of getting maximum profits. It must be about addressing health issues and not addressing the question of maximization of profits. And it's still a learning curve, but rebuilding working class organizations and their voices at the workplace remains a very critical area that we must embark upon. I will pause here, and the other issues I may address them during the Q&A session. Thank you.
Thank you very much, Norman. And you touched a little bit about stigmatization. If we have a little bit of time, I think we'll also look at that a little bit more deeper. In the meantime, I believe Patience has managed to resolve her technical challenges. Patience, can you come over and take the floor, please?
Thank you very much, Alamin. My sincere apologies with my, I was having some technical challenges today of all days. But thank you very much for asking me to be part of this panel. And thank you very much to the previous speakers and the opening remarks that were given. They were given quite a very good background in terms of some of the issues we're looking at. I'll just share my screen so that we can be able to just view the PowerPoint. I hope everybody is able to see my PowerPoint.
Yes, we are able to see it.
Okay. Let me start. All right, like I said, thank you very much for inviting me to be part of this. I was asked to speak on lessons learned from initial COVID-19 communications campaigns. Just a disclaimer around this, we were doing mostly content monitoring, media content monitoring. So there were quite a range of issues that have been discussed. One of the previous speakers did speak around communications campaigns and how they were also managing to send out information. We didn't manage to do in-depth studies around how people have been accessing information outside of mainstream media and a little bit of online media as well. But I think that the work that we've been doing in terms of media content monitoring was giving us an indication of what information is available to people, what information is available to people, what information is out there, how have the communications campaigns been conducted. So in terms of the way we've been monitoring, from the beginning, around March, April, we started monitoring in Zimbabwe. Up to around September, and in September that's when we started monitoring platforms from 7 countries in Southern Africa. So you notice that I note that we monitored 18 news platforms from Zimbabwe, but this was just because we are close to Zimbabwe. We are based in Zimbabwe, and we had ready access to the media platforms that operate here. So from September, we were looking at Botswana, Lesotho, Malawi, Namibia, South Africa, Swaziland, Zambia, and Zimbabwe, and later on we added Mozambique. So the results that I'm going to look at these countries, including Mozambique as well. So like I indicated, we focused a lot on the media and how the media was actually bringing out issues and what kind of issues were coming out in the media with regards to COVID-19. Maybe just overall, in terms of coverage of what issues were really coming out, we looked at 3 very broad categories and subdivided these. If you look at the tables that are there, you'll find the table to the left is from Zimbabwe, the table to the right is from the different countries, an average of all the countries in terms of what issues were coming out in the media. What we noted was that in many cases, countries focus so much more on statistics, how many people were infected, who was infected, what were the number of deaths, number of recoveries, issues like that. While this is important, there was much less information if you look at the tables around issues around how prepared are countries to be able to manage the coronavirus. The table to the left shows Zimbabwe in March, where you can see, for example, that 24% of all the stories just looked at those kinds of stories. How many people were infected, or how many people were affected, just the numbers. And when we're looking at the preparedness and the official measures that were there and the different laws, this was made up a high number. But what we noted was that it was really just reporting on the head of state has said this, the head of state has declared a state of emergency, stories of that nature, without really going that in depth to analyzing the different measures, what they would mean to the population. So you find that when we started looking at what responses were there around coronavirus, this number of stories went down quite significantly. And one of the more interesting findings were that there were very few stories that actually looked at the health infrastructure that is there in the different countries in terms of managing COVID-19. So we found very few stories, both in Zimbabwe and in the SADC region, in terms of the actual health infrastructure that was there, on especially when we're looking at issues of COVID-19. We also looked in our monitoring around issues of inclusivity and representation, inclusivity in terms of how included were different voices.
Sorry, Patience, to interject. We cannot see. Yeah, we cannot see the slide transition. We are just stuck on one slide, which is slide number 4. So maybe you can remove slide show. Then we just display the normal slide.
The normal slide, okay.
Yeah, without the slide show.
And show, yeah, this way.
Yes, but we are still on slide number 4, the first slide that you. Yeah, that way we can now see your slides. Yeah, sure.
Okay, all right. Thank you for that. Okay, let me go this way. So I was looking at issues around inclusivity and representation. So we were looking at representation of voices of different categories of people. We looked at people's professions. We looked at gender representation. We looked at rural voices as well. So when we're looking at gender, the trends were quite similar, where there was a very high number of men's voices as compared to women actually speaking on issues of coronavirus or any of the issues that were there. So the voices were very low. In Zimbabwe, of course, they were much lower than the regional average that we've been seeing so far, but still the average, we see women's voices not exceeding anything beyond 25% in any of the countries that we're monitoring. In some countries, I can always share a fuller report. We noted that women's voices could be as little as 0.2% in some media that were talking or reporting around the coronavirus. When we're looking at the voices that were coming out on coronavirus, a lot of them were official pronouncements, a lot of official pronouncements. This is what is happening. These are the statistics every day. So we found a lot of these voices coming out in the media. And I think an interesting aspect was the lack of medical experts, or fewer voices in terms of the medical expertise around what exactly is going on. It was quite interesting to note that sometimes you would have more of an official pronouncements. We've got this number of people that have died, but very few medical experts that were coming in to explain a lot of the statistics that were being told. And another finding was that there were also very few commentaries or comments from other alternative voices. Let me say, sorry, wrong slide. Alternative voices, for example, in civil society, where we're looking at civil society, CSO organizations that could present an alternative perspective around the pandemic or around interpreting issues. Some of the issues that would come out, for example, would be issues around corruption, for example. And with issues like that, you might actually expect a lot of civil society organizations or civil society voices to be coming out in the region to actually talk about some of the issues and how maybe to address some of those critical issues that we were seeing. When we looked at just where were the stories coming from in terms of coronavirus, we noted that, of course, a lot of the stories, when we wrote national there and on the SADC graph, it says generic. These are pretty much just general stories. There may be a law that has been passed, but when we now look specifically at maybe the urban-rural distribution of stories, there was a high number of stories that were coming out around on urban areas and very few in terms of the rural areas. And this gave an impression as if people in rural areas are not as affected by coronavirus as the other areas in the country. But this might not necessarily be true. It was more around what is it that the media was focusing on? What exactly was the situation in rural areas? There was very few, there were very few articles, both in Zimbabwe and in the region as well. Okay, let me move. I will just move. I can always share, or UNESCO can always share some of the reports that we've been doing, but maybe just to move to issues around professionalism. When we're looking at professionalism in media reporting, we focus quite a lot in terms of how the media is actually presenting people who have been affected or infected by the coronavirus. We noted that, well, there wasn't too big of a problem especially in the media we monitored in Zimbabwe on protecting people's identities. We found that there were very few cases where people's identities were not protected, especially those who might have been infected. When we saw challenges in Zimbabwe and in the region as well, was when we saw high-profile people being mentioned by name. And sometimes they would actually come out and say, I've been infected by COVID-19, by the coronavirus. And so a lot of these cases were the ones where we actually noted that identities were not protected. But in the majority of cases, we noted that media made an effort not to reveal some of the identities. And we thought this was commendable because it meant that there was very little stigma around. Okay. Sorry about that. In terms of the language use, this is just a small graphic from Zimbabwe, where we're looking at how were people who were affected by coronavirus actually spoken about. So you noted, for example, in Zimbabwe, like I indicated earlier, Zororo Makamba is one of the high-profile journalists who actually passed away from COVID-19 way back in April. So at the time that we did the monitoring, we found that there were a lot of mentions around this one particular case. However, we also noted that there were a lot of cases where we had people identified by their race or by their nationality, which became a bit of a problem because it all, especially at the beginning of the pandemic, we noted that a lot of cases in Zimbabwe were being mentioned in terms of their nationality. You would find Thai national there, for example. There's a British visitor. We've got an Asian traveler. We've got a Caucasian, a British woman. So it almost seemed as if COVID was coming from outside. And while it was maybe probably in response to the closure of borders and that presumption that we are closing our borders from maybe high-risk countries, for example, it also created an impression that the biggest risk was from outside. We are still to come up with our final report. I'm sure that the situation may have changed given the higher number of local transmissions, but at the beginning of the virus, we noted that this was quite a trend. And when we're looking at professionalism again, giving an example from Zimbabwe, a very concrete example, we found that the media panicked as much as citizens were panicking as well. This was a graphic that came out in one of our main newspapers, The Herald, where we found that graphic where they were looking at Zororo, the journalist I was talking about, and they actually did a graphic that showed all the places that were visited by Zororo Makamba. But what we felt was that this was extremely also sensationalist because there wasn't enough background to talk about the risks that were there, how much risk was there for people, for example, at the young man's Borodo home, at the bank that he visited. So you noted that maybe there was a bit of panic that was also coming out in the media and maybe reflecting what was happening in society. But we thought that accompanying such a story might actually be background information that helps people to be able to be safer when they were looking at when they were maybe if they encountered someone or they encountered this young man. So we thought that there was a need a little bit to be a bit more responsible in terms of reporting around issues. I had also, in terms of looking at how people were identified, in many cases, we saw that the media really didn't maybe put out images and videos of people who have been infected or affected. And we thought that this was quite positive because there was that sensitivity around just getting people who, revealing the identities of people who were infected by coronavirus and the risk that was there in terms of stigmatization. Some of the lessons in terms of the information that we actually found in the investigations, we noted that we found very little investigation independent investigation in developments. We noted a lot of official pronouncements, but very little in terms of investigation, what exactly was actually going on. When there were issues that were, or cases that came out in terms of corruption, that was problematic. In countries like Zimbabwe, for example, it still remains difficult to understand, for example, issues around hotspots. If there's going to be a lockdown or a second lockdown, it's not clear to say, okay, is the whole country just going to be shut down? So where are the hotspots? Is an area where you're reporting less cases going to be locked down as much as the area with the higher cases, for example? So we didn't find a lot of investigation independently from statistics that were presented by government officials. We also noted that in terms of actually looking at issues of inclusivity, there might be an issue of the lack of policy in the media houses and the need to have policies and enforce these policies in terms of promoting diversity and inclusivity, in terms of gender, in terms of geographic location, ethnicity, issues like that. These would actually enable journalists to have protocols that they can be able to follow when they are reporting on issues of COVID-19. We also noted that there were quite a number of challenges in terms of presentation of facts. And we felt that there was a need to do a little bit more fact checking in some of the reports that we found. You'd find, for example, you'd have a report that came out tomorrow, and a report sometimes in the same media house contradicts what was spoken about the previous day. So just the need to have stronger fact checking and triangulation of before publishing stories is very critical. We also noted that while the media looked at the lack of preparedness of government officials, for example, the media itself seemed to be unprepared to report on the COVID-19. And like I indicated earlier, there was quite a bit of panic in the beginning. But I think this could be something that could be down to just the lack of maybe training, capacity building in terms of specific issues, such as reporting on pandemics. And there might be a need to have more specialization and having media resourcing specialized desks that mean that journalists are always ready to present or to write around issues of coronavirus, for example, or any other pandemic or disaster that countries are faced with. And lastly, just to mention that just having clear professional standards that journalists can be able to adhere to, this also speaks to issues around training. Is there enough training that has gone into actually getting journalists to understand the issues around coronavirus, COVID-19? I think having media understanding what they're talking about, what they're reporting about, actually helps in terms of promoting better access to information by citizens. I will stop here, and if there are any questions, maybe if there's time, I will be able to take those questions. This is the end of my presentation, Alamin. Thank you.
Thank you very much indeed, Patience, for the very, very interesting presentation. I'm sure most of us would like to get a copy of this media content monitoring. And we are going to definitely circulate or distribute as wide as possible the results of this media content monitoring. And also I'd like to take this opportunity to really thank the European Union for supporting us in such a way that we're able to conduct this media monitoring in Zimbabwe and also in Southern Africa. Now, colleagues, we are running a little bit behind time. So I would suggest that maybe we skip the sixth session and move straight to session 7. And maybe if we have any discussion on stigmatization, we can combine that with a Q&A session. So I would like to invite the next speaker, Dave Lockwood. The floor is yours.
Okay, thank you very much. Alamin, let me just share my screen. Okay, have you got my screen?
Yes, we can see your screen.
Okay, I just want to spend a few minutes introducing a video that we created using 3D animation. as we're basically just running through this, I'm thinking of time. What we've seen in our engagements with the COVID discussions over the last 8 months is there is a need for more targeted messaging, and particularly a need to engage with the youth, but also something that's been talked about in South Africa at least, there's a need to save our breadwinners. If we can keep our breadwinners safe, then we can help save our economies. In May, in the urban areas, this is a picture from Cape Town in May. I think this is a visual way of explaining the problem, the challenges we're facing. In May, Cape Town, we had penguins walking around the city. In Johannesburg, we had antelope, etc., etc. Then we could move to July. This is a picture taken in Soho in our social dispart, and I've just pulled a graph out at random. This is Italy as of midnight last night. Italy had a huge problem in March and April, where the hospitals were overloaded, people were in a lockdown. And now we move to the end of November, or November current, and we're probably 4 or 5 times as many daily infections in Italy, and we're seeing that across Europe. If that comes our way as the second wave, then we do have quite a large problem, I believe, or we believe. In terms of moving forward, and sorry, excuse me, and talking about targeted communications, one gap we've seen is we haven't really spoken to the youth, and it's not we in Africa. It's, you see from that picture in London, the youth are also very, very blasé about the whole thing. We need to protect our breadwinners, and as has been talked about several times today, addressing the issue of the infodemic and the disinfodemic. So what I want to do is just introduce the video, which we've, as I say, we've created. The reason behind the video, if you can show why and how in a way that is engaging, and let's say inverted commas fun, then we have the engagement and we have a participation. And that will probably, in layman terms, even if they are complex concepts, the sort of type of media we're looking at, it's easy to make it multilingual, to translate it into other languages, translate the dialogue, I mean, and adapting the video for TV media and adapting the dialogue to a radio format is ways of getting messaging out into rural communities. We've also been talking about how to address, for example, deaf people, which I don't think I've seen any communication that targets to deaf people. It's quite easy. You just, as you see on TV, quite often you have somebody in the bottom right-hand corner of the video using a sign. So there are ways of addressing the people who haven't really been reached. So moving on from there, so I'm speaking quickly because of time, let me introduce you to the COVID family. To do that, I need to move to a video. Alamin, can you see the video now?
Yes, we can see it.
Okay, great.
Today, our African economies are starting to reopen. At the same time, infection rates in other parts of the world are again going up sharply. This is the second wave, and it is likely to be coming here too. COVID-19 has not gone away. It remains a cunning enemy that is changing our lives. So, we still need to keep washing and sanitizing our hands. And when we go out, we still need to wear our mask to cover our mouth and nose. And when we're out and about, we still need to keep at least 2 meters away from other people. Let's look at why these things are important. So, why do we still need to wear a mask? If you don't wear a mask, your breath goes a long way from you. If only one of you wears a mask, it's a bit better, but not much. It's much safer when everybody wears a mask. Now, do you get it? Wear your mask and keep 2 meters apart. Tao didn't wear his mask. COVID found him and he's now ill. He might even die. Remember, the coronavirus neither knows nor cares who you are. It does not discriminate. It is wrong to discriminate and treat people who are infected in a bad way. May soon increase again. Don't be reckless. Wash your hands. Sanitize your hands often. Observe social distancing and try to keep 2 meters away from each other. Avoid unnecessary gatherings. Wear a mask when you go out of your house. It is not only about saving yourself, it is also about protecting everybody else.
So, let's do the right thing, and we'll all get through this together.
Okay, well, that is the 3D video we produced. In terms of getting messages across and showing, I think the key areas are social distancing, where we use rings and crosses when the rings intersected. The breathing and how the breath moves from one to another. And on that, I will say thank you very much. Back to Alamin.
Thank you very much indeed, Dave. Now I understand why on your LinkedIn profile, you have said that with 3D videos and visualization, language and literacy barriers just simply fall away. I was asking myself, how brave are you to put such a statement? Now I understand. Thank you very much, Dave.
Thank you, Alamin, for those kind words.
No, I can see we are really behind time. Maybe Ellie, can you advise us if we have any questions from the Q&A box? Are there any questions which needs to be answered. Eli.
We have a couple of questions which we can bring up. Before we went into the questions, we wanted to start off from just reviewing the responses that we got for the pre-registration. I don't know whether we have time for that. You can advise me, sir.
If it doesn't take a lot of time, yes, maybe in 1 minute, 2 minutes.
Okay. All right. I'll just basically flash a graph. So allow me, I'll share my screen very quickly. Where is my screen? Okay, it's this one here. So Lisette and myself, we're going to just take you through this. And this is the, we thought it's important to just talk about what you responded before we go. My graph is a bit skinny, but I think you can see the questions. We had 6 questions that you responded to. Basically, this is based on 61 registrations and responses. And the first question, which dealt with, would you like to receive further COVID information? Obviously, we had over 40 registrants saying yes, they would like, and maybe others who are already flooded with this information said no. Lisette, do you want to take the second?
Okay. So on the second question, which was the initial COVID-19 pandemic communication strategy effective? Over 70% of the respondents said yes. And basically that means the message has been received and it has been effective.
The third question was to do with the use of local language, and we have already heard quite a bit about that. I mean, it was overwhelming unanimity that when something is presented in local language, it is far more effective. A few people did say no, and we can go into those kind of reasons, but I think there is a great unanimity there. Question 4, Lisette?
The next one was whether COVID-19 fatigue is an issue, meaning is there a level of complacency reached, the global population, and over 87% basically said yes, there is a fatigue issue, with only just under 17% saying no, it's not an issue.
Question 5 on stigmatization, I think presented very interesting results. As much as many people said yes, it was an issue which needed to be addressed either passively or actively. There were a few who said no, but interesting group is those who said maybe. If this is representative of the entire population out there, it kind of still points out that there is a great number of people who maybe are not very concerned about stigmatization, maybe not see it as an issue, or maybe they have other ways of viewing it. So that really was an interesting question, and I think it poses a result. It gives us some results which stimulate further discussion about stigmatization. Last question.
On to whom should the overall impact of COVID-19 and preventative measures be targeted? So these are talking about targeted communication. Overwhelmingly, over 80% said it should be targeted at the breadwinners, the youth, and the family unit, which basically encapsulates, the family unit, people who are in close contact, with just 29% saying it should still be targeted at overall society, and only around 8% saying it should be, impacted, the focus should be on the economy, and just only 3% saying the impact, overall impact should be, targeted at other sectors of the population.
Well, thank you very much. That's a very quick run through the questions that you responded to. And maybe this is something of further debate. But turning to the questions that have been posed, there is a question for Sorry, I need to just get here. Where am I? I'm here. Okay, a question for our speaker, Mr. Assad. The question was from Polly Geister, and she asked, I believe, Assad, can you say a bit more about your own messages, how you tested for transmitted, received impact of using more languages responses? What you had to change? Can your local partners also, do they translate your messages into other languages? That is a question for Mr. Assad.
Sure, thanks, Yusuf. And thanks, Polly, for the question. So first, I think like the messages were made, by like the health experts at like the CDC and like the WHO. And then I think, to answer like the two other questions, it's been like a learning journey for us as well. So when we started in May with the videos about the myths, we did like a landscape analysis after, we like released the videos, and like, we did like a quick like evaluation to see if our messages were reaching. And we learned two big things, language and, the distribution platform was the biggest gap. So of course, we knew that each country in Africa, has like many different languages. And if we look at like the whole continent, there's like thousands, of like different types of languages. So we knew that we couldn't go into each and every country and translate it, into like the thousands of languages. But basically what we did, we took, more of like a continental approach. So we found out what the 4 biggest languages were. And then, we translated each of our videos in English, Arabic, Portuguese, and French. So this first was to ensure that these messages, were able to reach the major regions, of like the continent. And then second, what we did to, to make sure like these messages were actually like open sourced. And basically like, we started to partner with a lot of like local, local partners. So what we did, like, so what that meant was, the local partners now could take the videos, they could translate it as they want, and then like, we're open, like as well, to work with partners, we can put their logos in the videos and stuff like that to ensure that like these messages are going out. And then third, what we did, as like we did with radio was, so our messages were not only going out in like the video forms. So of course, like we created videos, but then like through our partners, these messages now were being spread much more than just on videos. It was shared, by like community leaders in their speeches, to their community. It was spread through like COVID-19 trainings, by like the health experts, like within communities. And then also, as I had mentioned, it like, was shared doing like the radio where they would literally just speak out the messages that we create, I think, sort of like across Africa. And like, we like welcome, sort of like more partners to use these messages. And, I've put a link as well in like the bio. And, if there's any like specific language, that like anyone here wants to translate it, please do reach out to us. And, we'll be happy to provide, the approval and any support we can. And then like the last thing I just want to mention is that, we're a campaign, trying to spread these messages, but like, we need more campaigns. And, like when Dave was showing the video, that made me realize, how much there's a need, to support all of these campaigns, not just, not just one campaign or 2 campaigns, but basically, there's so much, that's needed. So the more support we can provide, the more better for the continent. So I hope that answered the question.
Ellie, are there any other questions?
Yes, Alamin, there's 2 other post them here, but obviously if there's no time, the attendees.
I think that's the best way forward.
Okay.
Yes, go ahead.
Can I pose the questions to both Patience and Olin then?
Please.
Okay. The first question to Patience, in relation to the panic that was created from the media perspective, the question is that, was there a channel or centralized process on COVID communication from a government perspective? And if not, would that have made an impact to minimize misinformation and media panic? And then for Norman, is there an indication of any communication gaps from a labor perspective between what government and employers have been communicating that can improve workers' situation? So those are questions. I can still email it to the panelists, Alamin, and then when they're ready, they can just, give us their written responses for us to be able to encapsulate in the report when we send it to everybody else.
Definitely. Let's take that approach.
Okay.
Colleagues, if there are no any other questions, I think we have agreed that the questions will be sent an email to everybody. The responses actually will be sent an email to everybody. I think we are now at the end. We have reached the end of our webinar. And to fully wind up the webinar, I would like to welcome my colleague, Paul Hector from UNESCO Cairo, to convey, and wrap up this webinar. And of course, thank all those who were behind the scenes to make this webinar a success. Ellie, Lucette, Benito, Ingrid. I can't mention all of you by name, but we really recognize your contributions. So thank you very much indeed, all of you. And over to you, Paul, for the closing remarks. Thank you.
Thank you very much, Alamin, and thank you to all the panelists, the audience, for the great questions that you've shared with us. I think this has been a very interesting and engaging event. And it is my hope that this will not be the end, that this is really just a stepping stone to continuing on this journey of communicating to more effectively address COVID and also communicate other developmental issues. So I'll just give a quick, wrap up of, just to refresh our minds about what we did today. So first we heard from the directors, and again, they talked about the importance of access to information and knowledge as key enablers in addressing this pandemic. And again, also they highlighted the fact that although Africa has been fortunate, we really cannot be complacent. We really need to work all together and join forces and really move forward and make sure that we can put COVID behind us. Then we heard from Access Challenge, and they talked about a lot of work which has been going on across the African continent. And one of the things, a very important point they raised was the importance of ensuring engagement, both at the highest levels, so bringing heads of state into play, but also making sure that at the grassroots level, we also have strong engagement from regular citizens. And again, we talked about the importance of influencers, sports, artists, etc., in making sure that we have strong engagement from the youth, who, as we know, make up the majority of the African population. Then we heard from Norman. Norman spoke a lot about the impact that COVID was having on the workforce across Africa. A number of very sad, very devastating social and economic impacts, both in terms of employment, but also there was also some very important rays of hope that Norman shed light on. And again, because of COVID, we saw measures that trade unions had been struggling at pushing forward in the agendas. For example, issues like ensuring a sort of a minimum wage, a minimum basic income. This was something that COVID has been helping to make possible. And of course, also putting squarely on the agenda issues around things like housing, mental health, etc. So despite the challenges, we do see some ways in which COVID is helping us to overcome current inequalities. Then we heard from our patients with Media Monitors Zimbabwe. Again, she did a really deep dive into some of what had been happening, and we see that still this whole issue of messaging, reaching the unreached, getting the viewpoints of various actors. The media is currently not doing as good a job as it can in this. We see a lot of focus on the urban areas. We see a lot of focus on what men are saying, but you know, from the rural communities who make up a large percentage of Africa's population, we're not hearing that. We're also not hearing from women and their views. And so this points to really the importance of, you know, really getting to the grassroots, getting to people on the ground, and also a need for building the capacity of our media actors, building the capacity of our media professionals so they can do a lot more in terms of in-depth reporting, because we're still just focusing on very surface level issues, statistics, etc. But what do they mean? What are the implications for our life? That's something which isn't being addressed. And so that's a gap that we need to address. And then last but not least, we heard from Dave Lockwood at Nality 3D Factory, and he showed us a video, again, emphasizing the importance of visual communications, the importance of conveying, using visual tools, the very complex scientific knowledge which is necessary for people to take action. And again, of course, drawing attention to the need to protect breadwinners and also persons with disabilities. So now we've come to the end. I'm going to ask participants, panelists, if they wish to maybe make very short, snappy, maybe 20-second interventions. But before I do that, and while you think about it, let me just raise what I think I see as the way forward. So I think we all agree that communication is a key issue, and we need to be more effective at it if we want to defeat COVID-19. And so I'd like to make an appeal. We really want to disseminate this video and also support other campaigns like it. And as we've pointed out, translation, getting content into the languages that people need, whether they're local languages or sign languages, this is really important. So we'd like to really get this video out. We'd like to have it dubbed over, translated, disseminated widely. And so we'd welcome your indications of support, your indications of interest. So if you can provide some support, technical, so be it in kind or financial support, please let us know. Please just email us. Please just let us know. You can quickly in the chat right now just put your email address and say, I want to be part of going forward, of moving this forward. And also, after you leave, please let others who you think would be interested in supporting this initiative know about it. That way we can really ensure that we reach all of those persons who are as yet unreached and who need to be reached. And I think if we succeed at this, we can really set an example here on the African continent, which other countries would want to follow, would want to replicate. Okay, so I stop here now. Thanks to everyone. And I just invite all the panelists in a very sort of snappy, popcorny way, just to, 20 seconds. What are your thoughts? What are the thoughts that you want to leave with the panelists? And then finally, Alamin, who will close us out. Thank you. We can go in the same order that we spoke. So I think that means let's start with Assad. Assad, let's hear from you. All right.
Great, thank you, Hector. So I'll keep it short. I think like the biggest thing that I just want to address is, even though there are talks about a vaccine, we do not know when this vaccine is. The other thing that we can do today is, like the best solution is, having a good communication strategy, and that is the best solution that will have the biggest impact, to curb COVID-19. And if we all step up, I think that will be like a better solution and like a better response for Africa. Thanks.
Thank you so much. Thank you so much, Assad. Norman, what are your parting thoughts for us?
Our interest is on providing sustainable education material in order to promote workers' education. And we found this platform to be a necessary platform to share such kind of production of materials, because communication is very, very, very critical during crisis management. And we've learned our lessons. We can learn from each other on how to do better when you are faced with pandemic or epidemic across the continent and the globe.
Thank you so much, Norman. Patience, what are your words, your parting words for us?
Thank you, Hector. I think we really need to focus a lot more on the long term. COVID is not going away fast. And so really investing in our communications is something that I think as we're going into the future, we need to put a lot more effort in. We need to put the resources, we need to put the finances, and just a call to governments, to organizations such as UNESCO to just continue supporting these processes that ensure that we have long-term strategies that can actually help communications around COVID-19.
Thank you so much, Patience. And before we go to Alamin, let's hear from Dave. Dave, what are your thoughts?
Okay, thanks, Paul. I've got too many thoughts to share in 20 seconds. But the big thought I've got, the vaccine issue, even if effective vaccine in Africa, the vaccines that can be produced in the next 12 months. Second thought, from the slides, the graph that I showed on Italy is a good indication that Europe is really stuffed up big time. In the first wave, we caught a cold about 2 months after Europe caught a cold. So the chances are in a month or two, we're going to catch our cold here. As Patient said, it's a long-term issue. We've got a chance to get it right, and it's all about communication and good communication and helping people to understand why. They have to do the 3 simple things, or we have to do the 3 simple things. Last thought is anybody who's in the audience who would like to address Paul or myself, even a letter of support, which we can use to help motivate. That'll be also very useful. Thank you very much.
Thank you, Dave. And now back over to Alamin. Alamin, you have the floor.
Oh, thank you so much, Paul. Actually, it's all your excellent and the excellent participation of our parts, any other points. And we look forward to your collaboration. Thanks and bye. Bye-bye.
Bye. Grazie.
Bye, everyone.
Thank you, everybody. Good job.
Bye.